Hello, everyone. I'm Saleha, and this is Chai, Chat, and Community. Tomorrow is World Autism Day, and to talk about what autism really is, I have with me tonight Dr. Soumya Basu and Sunayana Tonks. Hello, both of you, and thank you for joining me.
Thank you.
Hello.
Hi.
Before we start talking about a very, very important subject, Sunayana, do you want to tell us something about yourself?
Okay. Well, I'm originally from Bombay in India, and I moved to New Zealand around 18 years back, where I met my husband. We got married there, and we moved to Melbourne around 10 years back, a little bit more than 10 years. And I've got two kids. One, my son, who has autism, who's autistic. He's 9 years old, and I've got a 7-year-old daughter. And yeah, I work in the insurance field, heading compliance, and I'm currently studying law. So yeah.
Thank you. Shama?
My name is Soumya Basu. I'm originally from Calcutta, West Bengal. I grew up in between Calcutta and Darjeeling, and I did my medicine from North Bengal Medical College, which is in Siliguri. Did my post graduation from Central Institute of Psychiatry, which is one of the oldest psychiatric training institute in India, and one of the oldest in Asia, actually. I came to Australia about 17, 18 years ago. I've trained here as a child and adolescent psychiatrist. I work at Monash Health and have an adjunct associate professorship at the Monash University. I am the psychiatrist in charge of the Autism Assessment Service of Monash Health, and I have been associated with autism assessment in Australia for the entirety of my career. And autism has been my area of interest for almost 2 decades now.
Thank you. So, Shama, what exactly is autism and what causes autism?
Um, Autism is a neurodevelopmental disorder. So it is by neurodevelopmental disorder, we mean that the disorder that is impacting the development of the brain. So we have a number of neurodevelopmental disorders. The most common that we know of is intellectual disability. Autism is one of those neurodevelopmental disorders. We have other neurodevelopmental disorders like specific learning disabilities, developmental coordination disorder, speech and language disorder, and ADHD. In autism, we have it's a social communication disorder. So we have difficulties in socialization, and we call it emotional and social reciprocity, which is an ability to take other people's perspective intuitively, have a to and fro conversation, being interested in the other person during conversation, and ability to, and that impacts the ability to make and maintain friendship, peer relationships. Often they can have peer relationships which are older than them or younger than them, but exactly of that age can be a main problem. And then there is this difficulties in non-verbal language, eye contact, understanding facial expressions, having a full range of facial expressions that is impacted. So it is the verbal communication, non-verbal communication, and social use of language. Sometimes people can have exquisite language, very good language, but social use of language can be problem. So understanding sarcasm, double meaning, wordplay can be quite challenging. Uh, and then we have this restrictive, repetitive behavior. We sometimes keen interest in certain topics, which is quite intense, and they would spend hours together just researching on one topic, extreme knowledge in one topic, but not in other topics. Difficulty in managing change. Change can be major problem. You know, um, Then sensory sensitivities, you know, sensitivity to noise, sensitivity to light, touch, food. Some people would be avoiding a lot of food because they can be sensory sensitive. And then there can be motor movements, abnormal motor movements like hand flapping and twisting, turning, which is quite evident. Uh, Imaginative play can be problematic, and the play behavior can be quite repetitive. So, and uh, it is it is in a broad spectrum. So at one end we can have quite significant impairment in all these areas, and on the other end there can be very subtle difficulties. So, and it's and that's the confusing part. So unlike intellectual disability, the that the growth is slowed down, here the growth is in a different direction altogether. So there can be people who are exquisitely intelligent in many areas. As you can imagine, if they have this one area of interest, they can be extraordinarily bright in knowing about the solar system or the dinosaurs or volcanic um, volcanoes, and often these kids on the higher end of the spectrum can look like a little professor, not knowing a lot of things. But when it comes to friendship, peer relationship, perspective taking, understanding other people's perspective, that can be problematic.
Um, has there been an increase in autism? And if there has been, do you have any data?
Yeah, this is a brilliant and a very controversial question. Has there been an increase in autism? Look, the whole construct of autism, came into the psychiatric parlance in 1940, 1940s. Both autism and Asperger's disorder. And Asperger's disorder was really confined to the German literature. It came to the English literature in 1983. And so Leo Khanna was a Hungarian child psychiatrist, uh, very Hungarian. He went to migrated to USA in the 1940s in the aftermath of the Nazi movement in Europe,
World War Two,
and
yeah.
World War II. And in 1942, he described autism for the first time, and uh, ever since that, there used to be people with autism, but often they would be confused with childhood schizophrenia and things like that. So it came into existence not even 70 years ago, and then for a long time, it was the incidence of autism and the description of autism that was there in the past was this high-end, very severe autism. So that continued, and it was seen as a very rare condition. One, 5 in 10,000. That was the statistics. However, there has been a recent increase, in the diagnosis, especially in the Western world. Everything that we're talking about is in the Western world. We don't know much of the statistics of eight ninth of the population. We are talking about a very restricted global north population. There has been a steady increase to an extent where they are talking about one in 60. So if you're talking about pandemic, this is a real pandemic. So it has just gone increasing at a huge rates. The arguments around this is perhaps there is a better understanding of the construct about autism. There is also a skeptical idea that perhaps uh, it is following the funding models. Autism, unlike any other disorder, has got much better funding. So as a result of that, if their child is having other disorders which look like autism, which doesn't get funded, will get a diagnosis of autism, will get funding, which is actually very true in an Australian context, because we have uh, the National Disability Insurance Scheme, where sometimes when you have a severe autism, it becomes you get the help. So that whether that is uh, driving it's mainly about the awareness of autism, and there's a lot of research around that. And then the variants of the mild and the subtle variants are now picked up much more. At one point of time, it was seen as a very rare condition in girls, but in the last 5 6 years, there's been a tremendous increase in understanding about the manifestation of autism in girls, which now really refutes the theory that it is really rare in girls. The manifestation of autism in girls is much more subtler than that in boys, and hence, which was the diagnosis, the kids who were not diagnosed before are now being picked up. So it's mainly about awareness, mainly about uh, availability of services, understanding of the condition which is driving. And then there are some the skepticism that whether the funding models are also driving the increase or not. So that is the general sort of a consensus about what is driving. But what is not increasing, what is absolutely not a cause of increase, is it is not caused by vaccination. At one point of time, they were trying to find out environmental causes. Is there environmental toxins, and especially vaccinations, that was increasing the incidences of autism. It has been research. This is one of the most well researched area in child and adolescent psychiatry. It is definitely not increased by vaccination.
Thank you. So, Nana, when did your son first get diagnosed?
Well, he officially got diagnosed when he was 3.5 years of age. But, when I reflect back and I think about like the journey as a toddler and everything, I still remember, like, I used to notice, I was like, oh, why is he not playing with children? Oh, he's only 1.5 years, and they only parallel play. And he interacts very well with adults, with his childcare and daycare teachers. So I was like, okay, so he's got that interaction going on. But I still remember it was his second birthday party, and we had people over, and all he did was run into our bedroom and lie down there on the bed, and he kept chewing his clothes. So, and I saw there were similar kids his age from my mother's group who were there, and they were playing with the ball, they were catching, and they were interacting with other people around, also adults and other kids. A lot of them were parallel playing, so I wasn't too sure. And at that time, I was pregnant with my second one. So I think when I went on maternity leave, I started noticing I had him at home with me and not attending childcare that often. So I started noticing classic traits, like in terms of, like how Soumya said around, flapping of the hands. He used to always keep looking at his fingers. I'm like, why is he going on looking at his fingers? He's tippy-toeing a lot. And, there is that sensitivity to that light when you enter, for example, Target. I used to hate the lights there because it's very bright. And that's something that I noticed when he was a baby in the pram. Every time he used to enter that particular store, he used to lose it. The minute we come out, he used to be fine. I don't know if it was the light or what it was. But then, and his speech wasn't there. So he had like 4 or 5 words. And that was only like the cartoons that he probably watched. So we approached the speech therapist, and he was around 2 that time. So they said, we're actually not concerned. He's a boy. He's an only child. He's got nobody to look up to moral behavior and patterns of speech, like for age appropriate, or, like an elder sibling. So we're not too concerned. The only time we really get concerned is when he's 2.5. So we as parents also want to, you don't want to like sometimes face the situation, and then you're like, yeah, he's a boy, and boys are usually late, and, girls usually talk faster than boys. So we'll just let it go and he'll be fine. But that behavior continued. And I still remember my mother-in-law telling me, so Nana, if you feel there's something wrong, you should act on it. Don't sweep it under the rug. But if you feel there's something up with Ethan, my son, act on it. And I still remember my parents also telling me, because they had come down and they said, yes, for some behaviors which were not age appropriate for a child of his age. So then we said, okay. So we went up to a pediatrician, and the pediatrician told her, so we told him, and the pediatrician had some toys and stuff like that around, and he kept going underneath that table, the doctor's table. And he said he's not playing. I said, oh, because he probably doesn't want to play or whatever. I was trying to again brush the situation underneath the carpet. But I still remember saying that, no, I think it's just a speech delay. Once he starts talking, everything's going to be fine. Otherwise, he's always been well ahead. And he was. He used to be quite an attentive and aware child. And I still remember the pediatrician just nodding, and he gave us a referral, and he said, I'm going to get him assessed for speech and what level of speech he is. And I still remember looking at that letter, that recommendation or referral letter, which state that speech assessment for autism. So, and I really thank my stars at that point that we had a very good pediatrician who ignored what we were saying, and he did what was right and what he felt was right. So we went, my husband actually took him for most of the assessments. So they did a few hours of assessment, and they called us, and we kind of expected the answer. It didn't come as a surprise. So when they called us in and they told us, yes, he's got autism and he's been diagnosed, and this is all this information pouring into you, because you've done your research on Google and you've checked all these question and answer things that are available online, but you don't really know a lot about autism. So I still remember coming back from that, and by the time this whole process went on, it took us around 7-8 months to get that diagnosis. You've got to get appointments from the pediatrician, then appointments for the speechy, and then again go back to the pediatrician. So it was a long process, long waiting time. So it took us around 7 months to get diagnosed. By that time, he was almost 3.5. And he was actually 3.5 when we got the official letter. And and I still remember looking at that, and I think that was instant. I cried, and my husband was there, and we were like, oh wow, okay, what do we do now? But I still remember at that point, I thought to myself, I said, let's get your emotions out of the way. And I still remember the same day that he was diagnosed, I was thinking to my head, I was like, get your emotions out of the way. Now the pediatrician is giving you all these therapies that you could probably do, in speech, OT, or we do behavior analysis, ABA, which is another controversial topic, but it's about behavior management and things like that. But so then I think how I started focusing my mind, researching on the various therapies that were available. So I guess, that whole emotional roller coaster bit did not happen in the first instance. It probably came a bit later when, we saw that as he's growing older. I used to be like, oh, I don't want his birthdays coming up because he's got all these millions of milestones to meet. He's 4 now, but he's still not talking. He's 5 now. He's not doing this. He doesn't eat by himself. What do we do, So there was a lot of, I think, through the years, there's been a lot of emotional roller coaster, but I've always reminded myself in terms of don't dwell on it too much, because it's like a whirlpool that will suck you in. And once it sucks you in, you're there. So right now, your focus should not be I wouldn't say ignore your own emotions, but it's almost like, put your focus on how you can help your child. I think that's how it's been. But if I look back and I think about the years, I probably saw these traits with him before he was 2. But I didn't know what it was. And we just thought that, he's just a little child. He'll grow out of it, that attitude. And that's something I can say is that if you have a doubt about how your child is progressing, even when they're 1 year old or 8 months old, your children young as 1.5 are actually getting diagnosed. So if you ever have a concern or a doubt, you should act on it. And that's my regret that I probably didn't do it sooner. But we did it at 2.5, 3.5. He was diagnosed. But that's something that I always tell people is that if you have a doubt, act on it. Look into it more, There's no harm in going and meeting a pediatrician and having a chat about your situation or whatever. But yeah. So my son's 9 years old now. But
Shaman, do you agree with it? What should be the ideal age to get tested?
I mean, and
Because some kids do have development delays, yes.
After what she has said, it is very difficult to follow this. She beautifully described her lived experience, and and so as we have said, it is a big spectrum. When we have got people in the lower end of for Sunayana, it was not a very difficult problem. The language when the language is not developing at the age of 2. the, by the age of 1, you should have the first mama baba, something like that, and then within next few months you should have uh, phrase, at least one or two phrases starting. When there is a speech delay, definitely there should be alarm bells ringing. It might be anything. It can be intellectual disability, it can be delayed speech, it can be autism spectrum disorder, it can be also normal. In many families there can be a speech delay, and um, they can catch up, but that is a definite red herring. But um, often that the diagnosis is delayed because of the parental fear, and especially this is what I've seen in uh, the community from the South Asia, Asian community. It's almost a terrifying fear that it's not that it doesn't come from lack of awareness. Often there is a hyper awareness of autism, and I've had colleagues who are doctors, who know very much about autism, psychiatrists as well. They know autism inside out, but there's a terrifying fear about autism, that and there's a denial that it might be something, and what Sunayana just described so beautifully is the emotional roller coaster that the parents have to go through. It's a and what she said so wonderfully is every other children, like, when you go to the day, with the mothers group and things like that, there is this constant comparison that my child is has started walking. It's almost like almost a competition to prove that my child perhaps is smarter, and which happens, with toddler right from beginning. And then you have a child with autism who's not speaking at the age of 5, at the age of 4. There's no eye contact. It's a tremendous pathos that the parents, and the almost how to deal with your emotions, because your child is very different from others, and how to live with that, how to live with yourself. That is very important. So it's a big journey. And uh, getting in Australia, definitely we have a sometimes we there is this problem of overdiagnosis. When it is not autism, it is also sometimes seen as autism. And we had to uh, for every 20 pediatrician there is one child psychiatrist, and as a child psychiatrist sometimes we see patients who are diagnosed with autism perhaps would not meet the criteria, and sometimes uh, a diagnosis which is lifelong can be a real um, problem if you make it a wrong diagnosis. And hence your pediatrician took such a long time. It is a multidisciplinary. In Victoria it is very stringent. It has to be a multidisciplinary assessment. We have to involve speech assessment, an IQ assessment, an OT assessment, and then a full developmental history. Then normally usually we use an autism uh, diagnosis observation scale. It's a specific tool uh, to assess a child, a structured assessment tool, a play-based assessment tool. It's called EDOS. We use that, to which is often done by two clinicians to see whether we have got an agreement about is this child looking at. It's a structured play-based assessment which we do, and then a parental interview. We do what is called a 3DI, developmental dimensional diagnostic interview, or ADIR, autism diagnostic interview revised. It's quite an extensive level of questioning, which is all statistically uh, measured, and that that is the assessment process. It's a long, prolonged, uh, and the parents have to go through that emotional roller coaster. Uh, and but early diagnosis and early intervention is the key. There's no magic cure, but early intervention is the key. And often with early intervention, especially if you, without the diagnosis, often the child will be seen as stubborn. The child will be seen as a behaviorally problem, opposition defiant, and all these labels will be put into the child, and that can have a big, because the child has a neurodevelopmental difficulties. None of these things are under his control, and when the diagnosis is not done, there can be a long period of time when the child can be um, you know having a collateral damage because of that ignorance what's going on. So by the time, and this often happens in girls with autism. uh, we see this girls at a later age with other problems, significant other problems, where the main problem uh, was autism.
Yeah.
So Shama,
It,
sorry, no, no, you say, you go.
no, I said it does project differently for girls than it does boys. They tend to be a little bit more social than boys are.
Yeah, and that is what I was going to ask. So you did say that there has been an increase in of autism amongst girls. So what are the differences between boys and girls?
That's again, there's not an increase in, there was always there. it
But
was
it is
it was
now
not
being
picked up.
diagnosed.
It is now being diagnosed, now being picked up. A lot of research into uh, into the phenotype. We talk about how the presenting symptoms of autism in girls versus boys. Look, the severe, I mean, so we have this in our diagnostic criteria. We have level 1, level 2, level 3 autism. The severe autism is severe autism. It has not changed. The incidence has not changed, and nothing has changed. It is on the higher end, the subtle presentations. We used to call autism like Asperger's in the past. That there's a more and more awareness about that. So with girls with Asperger's, I mean, used to be called Asperger's, now we call level 1 autism. The social communication difficulties are more subtle. And girls use social mimicry much better. Social mimicry means they can imitate others, and just fit in and fly under the radar, and they can do social imitation and social mimicry quite well. So they can really go under the radar. They just mimic the situation, but they don't have that complete intuitive understanding about what's going on. And unlike boys who can have other behavioral difficulties, of emotional regulation difficulties, and becoming difficult to manage, which can get you the clear attention. The difficulties in girls can be flowing under the radar, and they can internalize. They can present with more anxiety and withdrawal, emotional withdrawal, than uh, the the physical and emotional manifestation of their emotional distress. So so as a result, they can internalize. The problem is peer relationship can be difficult, just fitting in. They can fleet from one friend group to other group, but not being able to have friends. And with friendship, uh, they they can, because of the problems with emotional reciprocity, and often they're just talking at you rather than listening, uh, and taking other person's perspective. They can become too overwhelming with friendships, because they can have a area of interest. One of my patient was quite interested in architecture, Jewish architecture, and give you a lecture on Jewish architecture. Get a topic, get into that topic, and talk about that, and talking at you. So often people would just say, "Oh my God, there she goes again," and the people will shut, and they won't have that understanding of the nonverbal language, and hence this friendship groups, and always feeling that people are not making friends, and they're rejecting, and they're not being able to maintain friendship. That can be a problem. The restrictive repetitive behavior with boys can be very classic. They can line up cars, and interested in vacuum cleaners, and being interested in one part of the toy rather than the whole toy. Those are the and interest in dinosaurs. Girls, the restrictive repetitive behavior also can be very very pro-social, a keen interest in Barbie dolls, which is shared by others too, but it is a
Yeah.
little more than that, or My Little Ponies is another one where they can be very much interested in that and much more, um, but it is more pro-social, and that makes it difficult
To
for
pick up. Yes.
to pick up. But when you retrospectively go through it, then you can see that there was these differences, and often, if there's a classic autism, they are picked up much earlier in girls. But often, what we are seeing is we are picking autism at a later age, and they float under the radar at the younger time. They would say that, look, I mean, I was in my own bubble. I did not give a damn about my social relationships, but then suddenly puberty hit, and this biological need to just be connected comes in, and then they get along better with boys because they can be rejected, they can be bullied by other girls, and the bullies, bullying experience of bullying is also very different. In boys it can be more belligerent, more out there. With girls it might be much more subtle, rejections and not being invited to birthday parties, and it's a different ball game altogether, much more sophisticated. And often you'll see that these girls with in the spectrum, they can get along better with boys who are much more easy for them to understand than girls, because at a say at around this, like, 13, 14, 15 years, the social maturity of girls becomes extremely more, and the difference then becomes much more. So so at a younger age, if there is a social emotional difficulties, it can be, you know tad different, but suddenly with adolescence, the social maturity of the girls just goes skyrocket into
Yep.
different level, and then the gap becomes more and more, so that becomes more evident. So the with recently, there is a lot of research going on about the manifestation of the core symptoms in girls.
So what are they?
It's all the same similar symptoms, the difficulties with social emotional reciprocity, but it is with more subtle. Next is nonverbal language. They can have a eye contact, but the facial expressions can be limited. And with the limited facial expressions, it is very difficult to read them. And in social situations, you don't know what's going on. They can have a very, very big poker face, but they're getting all this emotional hurt. They can have all these feelings, and then there is outburst. So from the green to red, without the amber sign. So which makes it very difficult for others. So because a lot of the communication is I mean, with the pandemic, we have understood when you put a mask on, it becomes so difficult. Even when you're talking, you can't understand what's exactly going on. So uh, the with autism, the facial expressions are limited, and their understanding of facial expression is limited. So that uh, makes it very difficult in that communication field. And as I mentioned, so we have got these two major symptoms, the social communication and the restrictive repetitive behavior. And the restrictive repetitive behavior in girls can be more subtle, so but that needs a thorough questioning and thorough understanding about their restricted repetitive behavior, which is so very pro-social that sometimes it is difficult to delineate.
So Nana, where did you get help?
Where did I get help? Okay. Um, it was with this, I mean, my help was first a pediatrician who's actually from Monash. He was a pediatrician who was there when I had my daughter. And then there were speech therapists that were known to him. And I think help for me is basically being in the form of we do like weekly speech sessions, weekly OT sessions, which is occupational therapy. And occupational therapy is more about, increasing his fine motor skills so that he can hold a pen properly, or increasing his upper core strength. Because my son's motor skills are really good in terms of his but his large the the motor skills are good, but his fine motor skills in terms of holding a pen or when things like buttoning up his shirt is very 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 less. So we always have to buy clothes which are just like you just pull it up and you wear it. And now he started to dress himself now, which is really great. And it's always all these small things which
Milestones.
actually
Yes,
matter.
absolutely. Yes.
Exactly. You have people going, oh wow, my child is this, and then we go, oh yeah, wow, my child actually wore his socks today. Isn't that great? It doesn't matter if he wore it upside down. I never correct him if he wears his socks up. No, just do it. You've done it. Great, good job. But at the same time, I have my daughter who's neurotypical, as they're called. So my expectations it's not that my expectations of my son is lower, but I know what his capacity is, what his capabilities, and you have to guide him better. But then, it's not that we differentiate or we compare them. But I just see, like with Elena, I might go like, oh wow, Elena, you did this, you did that, you did this big painting, excellent. With my son, if he traces his name, I'll be like, wow, this is just so great. Because I think it's all these, once you encourage these little steps that actually matter. But we actually did. There are different kinds of therapy. So you have like play therapy or floor time therapy, where the therapist sits on the floor and basically gets the child to direct them to play and sees what the child's interested in and plays accordingly, which is really great for early intervention. What we do with my son is called ABA, which is a scientifically proven therapy, applied behavior analysis. Prior to, I think, like a long time back, you could say that ABA was a bit controversial in terms of,
What is ABA?
ABA is called applied behavior analysis, which is the most scientifically proven therapy which helps children on the spectrum. But in the past, it was, everything was about you have to do this pattern only and try and change them and to act normal. But ABA these days is totally different. It's about, learning, okay, how can we break up, okay, pulling down a shirt, how do we break that up into different parts? So you make the child aware, label goes at the back, so you work on that. So they know, first you position the t-shirt properly, then you put it over the head, that action. So you might play with them and go, put your hands up, put your hands down. So it's broken up bits which combine into that whole motion. So that's what ABA helps with. It also helps with like behavior management and strategies and things like that. So we do that on a weekly basis. There are other similar therapies which parents, I think every parent should just research and see what is applicable for their child and work on that. But yeah, that's what we do. We do speech, we do OT, we do ABA. In fact, my son at a point used to eat everything, and for many years he stopped eating completely. So he used to like this textured food, just like crackers, which are hard and crunchy to eat. So his diet actually used to be roti, because it was, and only eating the corners because they were crunchy. Cruskets that you get here, those cruskets, he used to put Vegemite on it, corn cakes, and McDonald's chips. That's all he's eaten for the past 4 years, I think. And he's always had a starved look about him. So we've tried strategies to help him to eat other things, or even touch, feel, smell, taste and things like that. It just wasn't working. So we did this intensive feeding therapy at a clinic close by, where we did it over 4 weeks, day in, day out. You had to just go in there for like 6 hours and sit there and do different sessions of, so that really helped him. And now I can really confidently say, like, my son may not be the one who'll pick up a big piece of pizza and he'll eat. He's not got to that level, but he's eating a lot of food, So you've just got to work on what your, I think, what the gaps are, like what your child needs developmentally, and then work on therapies on that specifically. So that's what we do, Yeah.
Thanks. So, Soumya, what conditions are associated with autism? And you did say that initially Asperger's, it was called Asperger's. So what exactly are the difference between autism and Asperger's? Can't hear you. You're on mute.
That question is quite a big question, and there was For a better part of 2 decades, there was a huge debate about whether we should, what is Asperger's, what is the difference between Asperger's and autism, uh, high functioning autism and Asperger's, what was the difference? And now we have lumped everything together. Now, not we, it's Americans and Australia, and the rest of the world often follow America. So the main difference between autism and Asperger's would be that in autism, the speech problem is more significant. So Sunana's son has typical autism, so difficulty in developing speech. At the age of 4, there is no language. It is definitely autism. With Asperger's, there's normal development of speech. That used to be the differentiating point, the normal developmental speech. And uh, sometimes they can be really verbose, very, very good speech. But still, the social context of speech is difficult. So the speech can be receptive and expressive language, ability to uh, listen and understand and express what they're feeling. But then there's a social use of language. It's called the pragmatics of language. Understanding, talking with an intonation, understanding the subtle variations of language, um, and higher order language, understanding sarcasm and double meaning, wordplay, ability to synthesize. You read poetry and ability to summarize poetry. So those are the higher order. What is the meaning? What is the poet saying? So to be able to summarize that needs higher order language, or it's called metalinguistics, um, bringing in together. So in Asperger's, that with autism, speech is so significantly different. We are not even talking about that. With Asperger's, the language would be normal, but there's this higher order speech problem that was there. And the socialization would be more subtle. With autism, it would be more significant. But in Asperger's, they would not know how to start a conversation, or join in a conversation, or giving other person a turn, listening to the other person. So it's more subtle, and that can be very annoying. If a person is talking at you, not listening to you, you'll get annoyed after a while. And so the interventions will have to be different. And then with autism, with high functioning autism, they they can be very well coordinated. They might not be able to speak, but they can be absolutely well coordinated. In Asperger's, there was this problems with coordination. Not being able to tie shoelaces, very confused about left, right, poor handwriting, not being able to ride a bike. So those sort of coordination difficult, and catch a ball and do those things. And so what so for low functioning autism, we're not talking about it. It's high functioning autism means when they have normal intelligence, and Asperger's would have a normal intelligence. So it's not, there's no intellectual disability with Asperger's. So there would be this more of a coordination difficulty, more of a non-verbal difficulties. And with autism, some of these autistic people, they can't talk, but you give them a puzzle, they can solve puzzles in few seconds, and finish Rubik's cubes, and do 1,000 puzzle pieces in an hour, which is incredible. So that sort of difficulties. But nowadays we have lumped all of them together. I mean, the main problem was quite financial in America. The cost of autism became in 2010, the cost of autism per year was about $90 billion. $90 billion. That was the cost of autism in America. So they had to do something about it, and they wanted to really get out Asperger's out of the system, and tried to make the diagnostic system more stringent with the introduction of DSM-5. The second part of the question is, uh, what are the other conditions associated with autism? Autism is associated with all other neurodevelopmental conditions, like uh, high incidence of, so at the lower end of the spectrum, we have high incidence of intellectual disability with an IQ of less than 70, high incidence of that. A lot of them would be in borderline intelligence, high incidence of learning disabilities, specific learning disabilities, dysgraphia, writing. I mean, some people can be incredibly well. They can read well and brilliant in math, but won't be able to write. Dysgraphia, dyslexias, where normal intelligence, either they can have, there are two types of dyslexias, where one is reading accuracy, problems with reading accuracy and reading flow, and then comprehension problem. And after reading, not be able to comprehend what they have read. Then they can have coordination difficulty, developmental coordination difficulty, very poor gait, and that's why OT, the help from the OT is so important. Then they can have sensory sensitivity significant. I mean, so Nana's son was also suffering from a condition called AFRID, avoidant restricted food intake disorder. So because of the difficulty with texture and food and color and smell, food can be a major and very commonly associated with autism spectrum disorder, and it can be life threatening, because if you are restricting your food in that level, you are not getting the vitamins and the rainbow, which can be quite dangerous. Then there can be ADHD, which is the commonest comorbidity. This is the interesting thing about psychiatry. With the previous diagnostic system, we could not diagnose ADHD with autism, but now we see about 70% of kids with autism present with ADHD as well, where there's problems with hyperactivity, impulsivity, problems with inattentiveness, planning, organization, time management. So a combination of ADHD and autism can be very difficult, because if a child is very inattentive, they would not have the attentional span to learn social behavior, and that can impact their basic learning, because with all these therapies, ABA and social skills training, everything, you need to have an attentional span to learn what they're learning, and with a combination of these two can have an additive effect. Then there is neurological conditions like epilepsy is quite high in children with autism. As in a secondary level, when you are getting older, high incidence of anxiety disorders, social phobia, can be quite high. High incidence of depression. And then there is a link between autism and psychosis as well. So a lot of people with autism have got a tendency to develop more higher incidence. They're more vulnerable to develop psychosis. And the most important thing that we have to really remember is, because of autism, they are having the social difficulties and social communication issues. Every day when they go to school, they are at a chance of getting traumatized, becoming invalidated, bullied, put down, being told that you're different. And this cumulative effect of trauma is quite significant. And they are much more, because of their behavioral difficulties and their problems and their sensory sensitivities, they are much more prone to be abused. So as a result, autism children with autism can have a high incidence of post-traumatic stress disorder as well. So, and this combination of factors, and then there are other really complicated concepts. The flow of autism. What happens to this subtly autistic people who are not being able to really have friends, who are growing up? What happens to them? And often, a lot of them can have what as an adult, some personality disorders as well, which can develop because of the autism as well. So a whole gamut of psychiatric disorders that we see can be more highly represented in people with autism. And then the relationship difficulties and social difficulties, problems with employment, peer relationship, all those psychosocial difficulties can be cumulative, and that can result in the mental health difficulties as well. I hope I answered this question. It's a complex question, and I tried my best to answer that.
Yes. So Nana, Ethan has settled in well in his school, hasn't he? He's met friends.
Well, I wouldn't say he's made friends, but he does give people high fives, so I guess that's okay.
Small achievements, celebrating small achievement.
Exactly. Because I think once he started school, he wanted to try a mainstream school. There's always that fear of sending your child to a special school. Oh my gosh, it's like it's scary. It's a scary thought for any parent. But we did try 1 year of mainstream prep. And when he used to come back home with his laces tied so tightly that they left marks on his feet because the teacher didn't want him removing his shoes due to his sensory issues in class, that's when I said, what are we doing? I mean, are we going to, he's going there for 2 or 3 hours or a day. They weren't allowing him to come to school full time. And every time he sneezed, there's someone behind him. I still remember standing at a reception, signing him off, and he came running to hug me, and they stopped him, and I was like, "Would you do that to another child?" So we moved him to an autistic school, and it was one of the best decisions we've made. I mean, for my child, it suited him because he's nonverbal. He can understand. He's got very good receptive skills. He can understand exactly what you're saying. And if you tell him, give him instructions, he'll go, or go get your blanket from my room. He knows what you mean. He does it. But his expressive and communication skill is not there. So he's doing a lot of work around his communication device. We do a little bit of sign language. That's something that we really need to work on a little bit more. But his school, I mean, his independence in his school has really helped him. And, I think he's happy where he is, and he's always excited to go to school, which is really great. He does his circle time, they read books in class and everything, So I think for him, that school really suits. I mean, of course, you do have children on the spectrum who go into mainstream schools, which works great for them. But I think we tried both, and we just saw that and he's happy with school. So that's the main thing, for us. And he's being independent. He's learning new things. So yeah, so we're happy where he is.
So how are you celebrating every achievement?
Yeah, we of course we tell him when he does something great job and things like that. But we also make him feel that don't make too you don't jump around and screaming, oh my god, you did it, because you have to also make him feel it to understand his age. And he's 9 years old, and he's like a typical 9-year-old. Don't hug me, or okay, today I want to hug from you, or just don't crowd my space and I'll go and sit in my room. So he's like a typical 9-year-old also. So sometimes you have to be subtle in our praises also, like, oh wow, good job, well done, Ethan. Sometimes we might be a bit more animatic, but we celebrate every achievement. We just, like, when we compare what he used to do before compared to what he does now in terms of his independence, and right now my main thing is teaching him actually to that whole thing of pulling your seatbelt and putting it in. That's something that I'm working from. It might take me 100 tries to do it, but that, we focus on small things, we focus on certain things, and then we work on that, and then we move on to another task. Because I think one thing that I've realized through the years is that you have to give yourself also a break. You can't really always do it all. You have to take care of yourself also as an individual. So for me as a parent, and my husband also, we work. I work full time. Because I know that if I sit at home and I think about this all the time, it's not going to be good for my own mental health. And that's an avenue for me. So that way, I think I can be a good parent to him and, just focus on the task that he needs to do. And then we move on to new tasks. But yeah, it's been a long journey, but I think we're going okay.
Emotional journey.
Yeah. And you still have those days like, oh, why are you screaming? But then, and then he turns around and he's learned a new skill, and you're like, oh, wow, because we always call it the off week. So we have a couple of weeks where, he's quite off. Like he might have a lot of stimming happening. Stimming is where, you shake your hands or you jump or you scream, or he's just off, and he's just moody. And then suddenly he's doing something different. And you're like, so we always say his off weeks leads to something good. So that's the focus that we have when he's having meltdowns. We're like, maybe, it's going to lead to something good. There's something good coming out of this.
So
that's very positive.
Yes, that's very positive.
Yeah. But of course,
just one thing I just wanted to mention, about speech, this complete receptive language, but in I don't know about Sunayana's child or not, but there can be complete expressive language, but the social use of language is problematic, and that comes from a key concept in autism that we need to know. It's called the theory of mind. So the with normally we have a theory of mind. We understand that others have a mind which is different from us, and we need to communicate for us to explain what is going on in my mind, so that we have this innate understanding there. If we don't say, they would not understand. In autism, that is lacking. Often it is lacking in a big spectrum. I mean, it's different degrees of lacking. So and sometimes they can have a full developed language but not use the language, and can speak but won't speak because they don't understand why they have to speak. So
Yeah.
that can be the tricky part.
Yeah.
And
They
then
don't feel.
they can come up with some extraordinary long string of language, which doesn't mean that makes sense but completely out of context.
Um, Shama, what kind of tests are available? I mean, I know you said, 1 year onwards
That
you
is
should do,
it's a
but
neurodevelopmental disorder, which is highly a brain based. It is the brain areas of socialization and communication is not working in sync. That is the bottom line. But it's a full neurodevelopmental disorder, but the diagnosis is done by symptoms. So, and the holy grail of psychiatry at this moment is to find a definitive biological test, like to do a MRI or fMRI or something like that and find it, but it is still not there yet. And that is a holy grail. So huge amount of research going on to have a consensus decision, because it's Sunayana can tell you the emotional roller coaster. 7 months, it is a huge level of. So these are the tests that we will do a full developmental history, a complete big psychiatric screen, go through autism specific questions for the parents, which are drilling and drilling. I mean, normally I today Thursday is a day when I do the clinic. I see two patients, just two patients. I mean, as a very senior psychiatrist, which is, can you imagine? The amount of money that the government is spending. Two patients for the whole day. So 3 hours for one patient and 3 hours, and I would see this patient for 6 hours. I mean, 6 hours for one patient. I would be 3 hours for the assessment, and then for a feedback 3 hours. So there's no other condition where they will get this level of intensive sort of a workup, because of all this comorbidities and all these difficulties. We have to do that. So still the assessment part is very very much depending on questions and questionnaires and things like that, very thorough question, because ADHD, we have to ask so many questions, and anxiety disorders, you have to have so many family interactions, family all problems, intergenerational family history of, because there's a genetic component to this as well, so many questions to be asked. So as far as tests are concerned, very limited, but because it's a brain-based disorder, often we do an MRI or something like that, and uh, you know but we don't have a specific lesion base. Sometimes the brain looks absolutely normal, and still they can have autism. So um, but this is an area which is developing quite rapidly in perhaps when we are doing functional neuroimaging, where we are seeing how the brain areas are functioning. That will be quite important. And then some parts of the brain, lots like you know uh, the corpus callosum, which integrates different parts of the brain. And in autism, we see a bigger brain, and the interconnections between the brain areas are more impacted. you know uh, Normal cell death that happens in other normal brains doesn't happen, so that's why they can have this incredible strong areas in certain areas, but it's not connected. So they have got so but we don't have a 100% so we do a brain scan and say this is autism. We don't have a tool like that yet, but that's where the science is going towards.
okay. Thank you. Before we end tonight's show, Sunana, this has been a roller coaster emotional journey for you, and
Yes, yes.
it is going to be like that forever.
Forever.
What would you like to say to parents?
I would like to say one thing is that, as a parent, if that you have a gut feel about something is not right, or something you feel that your child is not developing as they should, or in par with, maybe their friends, or, you've observed, or you have another child and they're not meeting those milestones that you probably would expect. I mean, everybody develops at their own pace, but if you ever have a doubt, work on it. So if you have any family member who goes, I mean, I've never had a situation. My family's been totally supportive, but I do know of instances where my like people that I know or people that I've conversed with, where they have gone like, oh, their parents or someone else within their family goes, oh, no, 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 there's nothing, nothing, nothing. Even after receiving that diagnosis, and they go, oh, nothing's wrong, nothing's wrong. But you as a parent, you should know that if you feel there's a gut feeling about something, work on it, check it out. There's no harm in doing that. And earlier, and it's all right to sometimes not want to share this diagnosis with anyone. It's okay. When you're comfortable, you can share it with anyone you want to, or you don't need to. It's up to you as a parent. But at the same time, always be mindful that you just get your child the help they need. But initially, when my son was diagnosed with autism, we didn't want to tell anyone. Even with our own friends, we just hardly told a couple. And then we started telling people. And then reached a point that, I didn't want, to comment on anything on Facebook and things like that, because what if someone saw and they came to know that my child had autism? So I've gone through that phase also. But now, I openly in my work situation, or just generally, I do say, okay, I have a child with autism. And one thing that I've noticed is, because I'm now reached a point after many years, it takes a long time, that you can share your situation and generally comment on it or talk about it openly, that people are coming to me and asking me and saying, my daughter's not talking. She's 3.5 years old. What do I do? So that kind of in turn helps someone else. But reaching a point of wanting to share or disclose is your own personal journey, and you should do it when you're ready. But at the same time, like, that's one thing I just say is, if your gut feels that there's something wrong, check it out. There's no harm. What goes?
And as a parent, you would know. Yeah.
Yes, as a parent, you would know. There would be signs. You would feel a bit uneasy that something's not, something's a bit different. But yeah, oh, he's such an amazing child. I love him to the core, And his sister, she is just beautiful. She acts like, she tells me, Mommy, maybe I should have been born first so I can take care of Ethan. I was like, no, no, darling, it's fine. You're my little baby, and you be my little baby. So she's a very pure, very good soul, I always say, a very caring, kind child. And because she has seen Ethan's situation, at times she reminds me, he might scream and I might just oh, why is he screaming now? And she'll remind me, Mama, maybe he's just hungry, or maybe he just wants that, or he wants the TV on. Can you do it? So she's in tune to his needs also. And that's really great to say that, and I think siblings are really a good source of support.
Absolutely an amazing story. I mean, and the number of siblings that I've seen, who have just changed their lives and careers with this, and their wisdom that they get through this. It's a tough gig, because their rules and regulations are very different from their older siblings, and when they get involved in this sort of a thing, and what you have been able to provide, for both of them, it's quite amazing. And I mean, autism is one of the conditions where the psychiatric faculties and I mean, we have learned much more from the families than anything else. So and a lot of the people who have experienced autism, and those who are living with autism, and the siblings family, they have contributed a lot in the understanding of the condition. So we continue to learn from you and from your children. I mean, that's amazing, because your little child, she's the baby, but she will somehow will have to look after, they will have the longest relationship in their whole lives. Partners will come and go, there will be children, but a brother and a sister, they will have the longest relationship. When he's 99, she will be 96, with a 96-year-old relationship. and they will, and she will be able to look after him,
That's
which
amazing.
is quite an amazing story, isn't it?
Yeah. Sorry. Sorry. Thank you for joining me. It was really, really nice, Shamo. Thank you so much. Sanana,
It
what
was a
can I
pleasure.
say? Sanana, you're a hero. Sorry, I
No,
can't say.
You're a hero. You're a hero, Sunayana.
frustrating days also, but I mean, my support is my family. My husband, I tell you, he's just amazing with the children. Better than me, much better than me. So, yeah. Thank you,
Thank you so
guys.
much. Before I completely break down, thank you. Take care and good night, everyone.